For nearly 100 years, the Child Study Center, part of the Yale University School of Medicine, has been doing remarkable work with children in the area of mental health development. Dr. Fred Volkmer is the director at the Child Study Center and joins me now. Welcome, Dr. Volkmer.
Thank you very much.
When Dr. Arnold Giselle founded the Child Study Center, what was his vision?
He was one of the first two PhDs in developmental psychology in the country, and he came to Yale to really start a center that looked at normal child development and also to help children with problems.
Well, basically, though, what was the main mission?
He was really interested in helping people chart the course of normal development. At that point, people really didn't know enough about what children did at different ages, what kinds of things were normal, and what kinds of things were abnormal or signs of trouble.
And families were really hungry for information, and they still are.
That's absolutely right.
And that's why this study center was founded, to help families, really.
We actually have a very wide range of programs, clinical programs, research, training, and of course our main mission is to help children and families.
We'll talk more about that. Now, your faculty includes some internationally well-known staffers.
We have people in many different disciplines: psychology, psychiatry, genetics, neurobiology. So we really are studying issues that relate to children and childhood mental and developmental disorders, really from the gene all the way to the brain to behavior.
Now, how did you choose those specific issues?
It's interesting. Some of them, of course, are chosen by us and just by happenstance. Some of us are interested in certain kinds of problems. Others we've actually recruited. We've really tried to develop some new areas, and recently we're continuing to try to develop some new areas of work in some things like, for example, anxiety disorders.
Exactly. We're going to talk more about that as well. Now, the mission of the center is carried out through 6 interrelated areas, and let's talk about some of them right now. Research, very important.
As I mentioned, we do research really at a wide range of levels, everything from the gene, brain, behavior. We have people doing studies on how the brain processes information. We have people doing animal model work, looking at developmental disorders. Then we also have people working in the community, trying to translate what we know into actual research that lives in the lives of children and families.
But specifically, can you tell us more about that research? What are you working on now?
We actually are doing a range of things, including things like early diagnosis of autism, trying to understand the social brain in autism, new treatments for disorders like Tourette's syndrome. We're developing some new models for workout in the community, supporting children to prevent child outplacement from the home, either to foster care or other settings.
Now, how does that research lead on to developments of treatment?
We want to have good research models to then translate into actual work with children, and the work might be anything from medications to psychotherapies to new interventions in school to new approaches in treatment and working with families.
Let's talk about the clinical services that you provide.
We have over 20,000 outpatient visits a year. We have a very large child guidance clinic. We also have inpatient and partial hospital programs at Yale New Haven Hospital. And we also have a very large program which provides services for families and in the home, so that really the services are brought to the home where we think the action really is needed.
And what about training?
We train a range of individuals: child psychiatrists, pediatricians, psychologists, social workers, and others. And we have courses that we teach in Yale College.
What about training for families? Do you have anything specifically for them?
We actually have a whole lecture series, and we have a range of workshops and other kinds of services, and we're trying to develop some new programs. For example, we've started a clinic out in the Shoreline in Madison.
You work a great deal with many schools throughout the area, as well as communities in over 40 states?
Correct.
That's amazing. Now, why do you do that?
Well, we want to get the word out from what we know from research into the lives of children and families. And we have some wonderful people. Jim Comer, who's been working for years in terms of bringing mental health principles into school settings. We have programs that work with police and community policing to help the police know more about children and child development, and that can then inform their police work.
You actually go beyond this country. You also work internationally as well.
We're, I think, in over 40 countries around the world. We have a range of programs. We have ongoing relationships in England with the Anna Freud Center. We do training on an ongoing basis in Italy and several other countries. We have connections really around the world.
And you also focus on policy issues right here in our state.
That's absolutely right. We look at things like safety issues in daycare, children being expelled from daycare. We're interested really in translating what we know from research into the lives of children and families.
So much information for families. Now let's talk about some of the events you do have coming up. Now the first one is happening September 7th, Looking to the Future, Changes in Service Delivery for Young Children at Risk for Autism. That's Tuesday, September 7th. Dr. Amy Klin will be there. She is the director of the autism program at the Yale Child Studies Center, and that's at the Greenwich Library. Let's talk about autism. There's a broad spectrum now of autism.
There's been much more interest in autism over the last 20 years, especially over the last 10 years. I actually came to Yale in 1980 to work with a man named Donald Cohen, who was an autism researcher, because I was interested in autism. And since that time, there's really been just a mushrooming of interest. People have gotten much more aware of autism as a phenomenon. We also have done a much better job of treating children, so children are doing better. We now have more and more children going to college.
And you have more and more children who are being diagnosed with autism because more people are more aware of what to look for.
That's absolutely right.
You also have a book that you wanted to share with us.
That's a book written especially for parents and teachers, and that really tries to translate a lot of what we know from our research findings into practical information that could be helpful to parents and teachers and families.
You have another event coming up. That's Thursday, October 28th, Managing Anxiety in Young Children with Dr. Michael Crowley at Greenwich Hospital. And you don't really think about young children experiencing anxiety.
No, one of the interesting things, I was talking to one of your staff this morning, is so many disorders that adults have actually start in childhood. And anxiety and mood problems are some of the most common disorders that young children have, and they sometimes persist. And sometimes it can be hard for parents to know what sort of normal levels of worry and concern, and then what becomes more really debilitating for children.
What are some of the warning signs for parents?
Excessive anxiety, fearfulness, sometimes sleep disruption, really a range of problems, sometimes irritability, changes in behavior. One of the difficulties with younger children, of course, is paying really good attention and trying to understand, because the communication difficulties in young children make it harder for them to really voice some of their feelings.
And the last event that we want to talk about is in November, and it's Is Your Child Ready for School? That's Tuesday, November 2nd at Greenwich Hospital. That is an issue a lot of folks are trying to decide for their own child. Sometimes the child is not emotionally ready to get into kindergarten.
And especially because kindergarten, people often focus on the cognitive, and in fact it's really the social that's the big part of being ready for school, and so that's one of the big elements in terms of thinking about that whole set of issues. And it's interesting because that was one of the things that Arnold Gazelle was really very worried about, was not pushing children too quickly to go to school, giving them enough time that they should be ready for school and have a positive experience when they did go.
And so parents really need to consider all of that when they're trying to decide whether the child is ready for kindergarten.
Correct.
All right. Thank you very much for all your help here. If you want more information about the Child Study Program at the Yale University School of Medicine, all the information is right there on your screen, or you can come to our website. We'll link you to it as well. Dr. Fred Volkmer, thank you again for being here.
Thank you very much.
And coming up next, we are making brownies with the delightful Holly Pinafore when Connecticut Style returns. Stick around.